Public Health Services of the Ministry of Health, and Professor Upul Senara, Professor of Community Medicine, Department of Community Medicine, Faculty of Medicine, University of Colombo. Over to you, Chairperson.
Good afternoon. It's really pleased to be here because although now Additional Secretary Public Health Services, I started my medical administration career as the Director Non-communicable Diseases in 2001. During that time, I was able to start this National Injury Prevention Program of the Ministry of Health. Otherwise it was scattered everywhere. So I am really more than happy to see that injury prevention program coordinated by the Non-communicable Disease Unit of the Ministry of Health is going ahead with very professional events. So, and this has been one of my pet subjects. Why this is important, I know that, I am sure that you have been telling even during this conference and all the time. In our country, this is the leading cause of hospitalization for consecutive years since 1995. So we need to do something because certain components are stagnating. Now coming to the session, I think this is the last session. It's very happy to co-chair with our colleague Professor Upul Senara from the same specialty. You have coupled many things in this session. Community engagement, social marketing and partnerships for effective injury prevention. Little bit of community engagement in public health, it's a critical component of injury prevention and very essential for successful implementation of injury prevention strategies. And it should be implementation of injury prevention strategies with the community rather than in a community. With those words, I will invite my co-chair to introduce the first speaker.
Thank you, Madam. There are three speeches in this symposium, and we spent about 15 minutes for each speech, and at the end of all three, we will have a common discussion of about 15 minutes. So let me introduce the first speaker, Dr. Sheelani Gunarathna. She will be speaking about the community-based approaches involving local communities in identifying injury risks, designing interventions and implementing programs tailored to their specific needs. Dr. Sheelani Gunarathna is the medical officer NCD attached to the Regional Directorate of Health Services, Gampaha. Over to you, Dr. Sheelani.
NCDs in Sri Lanka, it's divided into chronic NCDs and acute NCDs. Here we are more considering about injuries, that is consist of 10%. And this is information on NCD risk factors in Gampaha district. Can see overweight in male 26.96%,
female 32.73%, obesity in male 6.93%, female 13.68%, high blood pressure in male 25.53%, female 22.47%, high blood sugar in male 10.25%, female 8.09%, and cholesterol 5.33 in male and female 5.42. Disease burden from injuries, Sri Lankan context. Number one cause of hospitalization over the last 2 decades, accounting for 1 million cases per year. Each minute, at least 2 injured individuals are admitted to any government hospital. About 17 to 18% of total government hospital admissions are from injuries. Estimated number of 2 to 3 million injured persons are treated in OPDs of government hospitals or private and Ayurvedic sectors. 1 out of 5 from the whole population are affected yearly. 11,000 persons with injuries may receive health care daily. At least 8 Sri Lankans receive medical care every minute. Falls are reported as 24% of admissions. Out of total, 40% reported injuries occurred at home. While traveling, 24% of injuries occurred. Injuries killed about 3 individuals in every 2 hours. 4th leading cause of deaths in Sri Lanka. The mortality is projected to increase in next 10 years due to rapid changes in lifestyle of people. The most vulnerable are from productive age group, and it is also the number 1 killer of that age. This is based on National Injury Surveillance System. Gampaha district outpatient surveillance year 2023, 13,707. This year up to now 9,498. Inpatient surveillance year 2022, 36,639. Injury death surveillance 530. Altogether for 2022, 50,876. And up to this year, it is 35,465. So deaths last year for Gampaha district 530. This year up to now 383 due to injuries. Injuries persist as a formidable global challenge as a leading cause of death and disability worldwide. Injuries exert a substantial toll on the nation's healthcare system and economy in Sri Lanka. Health promotion at the community level is important. This requires a holistic and interdisciplinary strategy that relies on active community participation. The Safe Community program, adapted from the Global Safe Community Initiative, modified to suit the country's specific context, addresses a spectrum of health issues beyond injuries. Safe Community. It's a designated geographical area. All sectors of the community working together in a coordinated and collaborative way to promote safety and health and manages risk, increases the safety of its members. Safe community includes safe food, safe schools, traffic, safe homes and leisure times, safe children, safe elders, safe work, violence prevention, suicide prevention, disaster preparedness, safe public places, safe hospitals, safe sports, safe water, many more. Safety issues identified: tobacco, alcohol prevention, improve dietary habits, physical activity promotion, mental health promotion, improve air quality, cancer prevention, chronic kidney disease prevention, food and waterborne infection prevention, vector-borne disease prevention, including mainly injury and violence. So, to establish safe community in Gampaha district, we identified first the relevant stakeholders. As I told earlier, at district level, we identified district secretary, regional director of health services. At divisional level, divisional secretaries and medical officer of health. This is advocacy. In 2000, this is 2017, started from since 2016. Advocacy to non-health sector organizations including district secretary and divisional secretaries, followed the planning meeting co-chaired by regional director of health services and district secretary. Then advocacy to non-health sector organizations, divisional level or divisional secretaries. For each and every divisional secretaries in Gampaha district, all together 13 advocacy done. Then develop an action plan with timeline and responsibility at each divisional secretary level. Then we did awareness for health and non-health sector stakeholders and established a multi-committee at divisional secretary level, included Grama Niladhari, Samurdhi Niladhari, agriculture officers, other development officers, economical officers, and from health sector, MOH, PHM, PHI, and many more. Then they selected one Grama Niladhari division from each MOHO district divisional secretary division. As example, Attanagala division in 2016 selected Kattota Grama Niladhari division and Vattala, Handala North, Jayala, Vishakawata. Like that, in all 15 MOH areas selected one area. One area from each divisional secretary in 2016, then 2017, then 2018, altogether 45 safe communities we selected to develop. This is exchange of experience at Attanagala Regional Secretariat, that is Divisional Secretariat, after implementing first safe community in 2017. Here the officers attended Divisional Secretary, Assistant Divisional Secretary, Medical Officer of Health, Attanagala, Assistant Director Planning, that is Divisional Secretary Office, Administrative Grama Niladhari, Development Officer Planning, Public Health Inspector of the Pradeshia Sabha, Development Office, all other development officers, Sub-Inspector of Veyangoda Police, all government officials in Kattota Grama Niladhari, and all government officials in Pattigoda, that is in second group and first group officers. Then carry out a survey in the locality to identify problems by the working group. It is situational analysis at village level done by Grama Niladhari and all divisional secretary officers and all our health officers both together. Then they prioritized the problem and developed an action plan with time frame and responsibility. This is done by each and every divisional secretariat level is groups, that is each year 15 and all, for all 3 years 45. After that they established this safe community gradually. They developed various things and we reviewed the progress of activities periodically at safe community at Ministry of MOH and Divisional Secretariat level, that is at grassroots level. We visited each and every house in the district that is established this safe community. Visited by MONCD from RDHS level with district secretary level, planning director, district secretary. All Grama Niladharis here you can see, and various other people. We went each and every house to see what they are establishing as the safe community program in their houses. Then review the progress of activities periodically at safe community district level, that is 3 times for the year conducted review meetings, chaired by District Secretary and co-chaired by District Secretary and Regional Director of Health Services, with Directorate NCD, Cancer Control Unit, led Health Promotion Bureau, and here you can see District Secretary, previous District Secretary, Mr. Sunil Jayala, addressing and reviewing the process. These Gram Niladaris and our health officers were presenting the progress. Results. For injury prevention, you can see various things here. These gas cylinders, they kept outside the house. In each and every house, for this first aid kits, they established these things for first aid. And this home safety checklist they implemented in each house. Our midwives, they have given health promotion program relevant to those home safety checklists. They separated these various poisoning matters and things separately they kept. And this is unsafe wastewater drainage in CIC factory. This is done by PHI area, Jayala MOH area. Mainly PHI, Jayala, they implemented this. You can see before and after pictures in 2017. In Vishakhapatnam, that is again Jayala accident road culvert, before and after you can see, done under this program. And injury prevention in factories, Mellow Metal Work Factory, first aid unit, before and after you can see. And prevention and reduction of tragedies caused by road accidents. They have taken many measures to improve the knowledge of these villages with police. Not only injury prevention, agriculture. They did many more to improve agriculture, home gardening. This is our collective effort, that is collective effort by MOH team and divisional secretary team. Again you can see the same process. Then healthy diet for school children. They have started Suraksha Sarya, that is a mobile van that carried various food, healthy food for school children. Parents, in the morning parents could buy those food. This is Sinikurulla, again from Jayala area. This is a traffic light system again in 2017. Our PHI given to all safe community places, homes. This Sinikurulla picture with 31 balls here. And every day they can mark it as red or yellow or green according to the amount of sugar that they used. And finally, at the end of the month, they can assess themselves, householders can assess whether they have used, how many sugar they used for each day. This is salt usage. They have mentioned this in a calendar in the kitchen, and they check whether they are using more sugar. This is storage of salt, before and after, correct storage after. And this is for the waste management. They have this is Tihari area. They made these bags for waste management and various methods they use to manage waste. And here again waste management. This is various emerged areas in Gampaha district, not in one place, not a one place. This is Nigambu side. They have placed a notice board explaining the importance of not dumping waste in the lagoon. Then kitchen management 5S. They did various things really. We felt that these houses and these kitchens are better than our ones really. To that level they did it. Then physical activity program they started in every safe community for school children, for village people, night classes. Even 85-year-old ladies were practicing physical activity in those programs. Self-employment opportunities, then art competitions, no tobacco areas, and medical camps, NCD screening camps, and they did data analysis also. And this is spiritual things, MCH activities, Sitam Kanta special programs, counseling, mental health, like this, lot of various activities we established in those safe communities, suggesting let's light a lamp for the nation. Thank you.
Thank you, Dr. Sheelani.